Hello, I am Dr. Veerendra Koujalagi. I am medical gastroenterologist practicing in Sahakar Nagar, Bengaluru at my clinic Eka Gastro and Liver Care. Bloating is a very common symptom we often encounter in our outpatient department. Bloating happens whenever there is increased amount of gaseous distension of stomach or small intestine. But is bloating a serious issue or it is because of the food intake that is happening? So, bloating often is because of the type of food that is taken in and inability to process those foods. So, especially people who are taking foods, one of the most common symptom of cause of bloating would be some lactose intolerance, where you are unable to process the lactose in your milk or milk products. And there are other substances called as FODMAP, which contain fructose, like some fruits like apple can cause excessive eating of that can cause bloating. And also there are other vegetables like Brussels, broccoli and all that which can cause bloating, as well as some of the beans can cause bloating. So these are the food materials which cause bloating. And also bloating could be a sign of other disorders where there is pain or discomfort happening because of the abdominal distension. So when does this happen? Whenever there is a bacterial overgrowth, also this bloating can be experienced. So this is called as small intestine bacterial overgrowth. So this happens whenever there is sluggish movement, commonly seen in diabetics, can also be seen in patients with hypothyroidism and other disorders of bowel movement. So testing for small intestinal bacterial overgrowth or lactose intolerance can be done by breath test, although they are not easily available, but we can pinpoint and find the cause for the bloating. Rarely there can be bloating because of other diseases like pancreatic disorders, stomach ulcers, and also because of gallbladder issues. But most commonly it is because of impaired bacterial overgrowth or intolerance to food that you are taking. And treatment can be easily done for small intestinal bacterial overgrowth by a course of specific antibiotics. And for food intolerance, we have to look for what are the foods that you have to eliminate and eliminate them. Then you can get free of bloating.